Hello, I'm Don Armstrong. This video is for men and women 55 to 80 years of age who currently smoke or quit within the past 15 years. These men and women may benefit from lung cancer screening. Currently, the only recommended screening test for lung cancer is a low-dose computed tomography or CT scan. Screening helps find lung cancer early when there is a better chance for cure through surgery. Most lung cancer occurs in people 55 years of age and older, and in people who frequently smoke or have smoked for a long time. Unfortunately, most people who develop lung cancer die from it, usually because it is found too late. If you currently smoke, quitting smoking is the best way to lower your chances of dying from lung cancer. Ask your healthcare provider for information about quitting, or call 1-800-QUIT-NOW to find a program near you. Screening is a medical term for testing to find a disease before it causes any symptoms or problems. It can help find cancers at an early stage when they are easier to treat. However, screening should not be viewed as something to do in place of quitting smoking. A low-dose CT scan is a simple, pain-free procedure which uses X-rays to scan the entire chest in 12 to 20 seconds. Throughout the procedure, the person lies very still on a table while passing through the X-ray machine. If something suspicious is found on the scan, it does not necessarily mean you have cancer. You will need to wait for further testing, such as additional CT scans or a lung biopsy to prove whether or not it is lung cancer. If nothing is found on your CT scan, it means that you do not have evidence of lung cancer at the moment. You could still develop lung cancer in the future, or the scan could have missed a cancer. If your CT scan does not find cancer, that is not a reason to continue smoking. For the most benefit, you should commit to being screened every year. Research shows that annual screening with low-dose CT scans reduces the risk of dying from lung cancer by about 16 to 20%. If 1,000 smokers 55 to 74 years of age were not screened with CT scans, 21 would die from lung cancer within 6.5 years. If these same 1,000 smokers were screened every year for 3 years, 18 would die from lung cancer. That means that 3 fewer smokers would die from lung cancer because of screening. Also, screening leads to fewer deaths from all causes. Screening can find other health problems, like heart and lung disease, that may be treated earlier. There are also some potential harms of screening for lung cancer with the low-dose CT scan. People are exposed to a low dose of radiation. The overall risk of radiation from lung cancer screening over many years is not known. Lung cancer screening with a low-dose CT scan may provide false results. If 1,000 smokers are screened every year for 3 years, about 120 people will have a false alarm. False alarm happens when the test suggests a person has lung cancer, but that person does not have lung cancer. About 14 of these 120 people will need a test that involves putting a tube into the lungs or having surgery. Some people may be treated for lung cancer that would never have harmed them. The benefits include reducing the chance of dying from lung cancer and finding other health problems that might be treated earlier. The harms include exposure to radiation, false alarms, and extra tests, and the chance of being treated for a cancer that might never have caused harm. Think about the reasons you would choose to be screened and reasons you would choose not to be screened. You should weigh the benefits against the harms and work together with your healthcare provider to make a decision about whether lung cancer screening is right for you.